Hello everyone, welcome to this Partners in Care in Health webinar. I'm Rachel Carter from the Partners in Health Autistic People and People with a Learning Disability team. This webinar is intended as a jump-off point to give everyone the basics of how the changes taking place in procurement might affect people with learning disabilities and autistic people. I'm delighted that Steve Eade, Head of Procurement at Essex County Council and Chair of the South East Procurement National Advisory Group, and chair of the Central Buying Consortium, which is a group of nearly 30 councils in the southeast and east of England, has agreed to chair. And he's been involved in some of the conversations about the development of the Procurement Act and has a procurement background.
Thank you, Rachel, and morning, everyone. And firstly, delighted to be asked to chair this meeting today, which covers some important changes in regulations, which I think all NHS staff who procure and commission, NHS and local authority staff who procure and commission adult social care services need to know about. And there's a specific focus today on learning disability and the autistic sector, which is of particular interest to me at Essex as well. And we all know that services for this group need to be personalised and can be lifelong. They need to be designed with and for people, and careful joint working needs to happen between health and social care staff to make sure that the services bought give people the support they need to have an ordinary life. We've a great programme today, which will update you on what's happening for the regulations from people who've been involved in their development, and they'll be able to tell you what impact they think they will have. We're also joined by Julian Blake, who's a lawyer from Stone King and a strong advocate for the flexibilities in social care and health procurement. He's going to talk you through his perspective about what he thinks is possible within the new legal framework. Rachel's already mentioned that they intend to create a myth buster and has already asked for people to contribute towards that. And she's also mentioned that she's interested in hearing from people who've got good news or good stories to share from this sector. So I think that's it from me at this stage, and I'll now hand over to Greg Povey, who will talk you through changes that are coming.
Good morning, everyone. In 15 minutes, it's not going to be possible to cover every aspect of the Act in detail. So what you can see throughout my presentation is links to many Cabinet Office pages, for example, on the bottom of this page. So I think that everybody, they're there for everybody's benefit for learning and development, and you could benefit greatly from this. So I just highlighted, signpost you to that. So if we move on to the next page, essentially this comes with a caveat that this is meant to be a presentation to stimulate discussion. You'll need to seek your own independent legal and procurement advice for any actions that you intend to take from this. But what you can see is there are lots of links there for you to be able to see a huge amount of artifacts that are there to intend to prepare you for the legislation when it comes in. Okay, if we move on to the next slide. Okay, so the legislation is online. It's on that link that I shared on the opening slide, but also there are lots of other further pieces of information that would really benefit you if you could read them as well. The first is the explanatory notes that are designed to be read alongside the Act. Especially for this audience, there is a separate knowledge drop artifact purely about the light touch regime, which I've tried to summarize into one slide, but nonetheless, I'd recommend that you have a look at. Also, there's further information due out in February and in March coming up next year, which essentially is what they call the statutory instrument. It's further guidance. If you haven't done so already, you could register with the Cabinet Office gov.uk page. It's called Transforming Procurement, and then you'll receive links about any further updates. Okay, if you move on to the next slide. Okay, so what's this all about, this new Procurement Act? Well, we joined the World Trade Organization Government Procurement Act on the 1st of January 2021. And essentially what we've done is we've, as a nation, is we've used that as an opportunity to try and generate better outcomes and more flexibility from our procurement. So there's some key aims that we're trying to achieve as a nation from this. Obviously, value for money it carries on being a key objective. But also what you'll notice now is the phrase maximising public benefit. So maximising public benefit, to my mind, is kind of really enforcing the social value aspects. So not only what you get from delivering your specification, but what else can be provided to maximise public benefit in addition to the main aspects of specification. So that could be opportunities either in the employment area, or they could be contributions towards carbon reduction, things like that. You'll also notice that the word integrity's being included, and integrity, they're saying, must sit at the heart of the process. Essentially, it's around good management, prevention of misconduct, and to prevent fraud and corruption. Also, you'll notice that the Act discusses quite a lot about conflicts of interests as well. So one of the things they've done as part of producing this new Act is to benchmark some of the best procurement capabilities from other countries in the EU. And from that, they've actually focused a lot on the fraud prevention and also the debarment list and things like that as well. Also, the Act is quite clear there's a duty to remove barriers facing SMEs. And there's also some good work that's being done with the central digital platform and find a tender service that has been done to kind of also enable reducing barriers to SMEs as well. Okay, so the idea is that it's more simple, more flexible, and that it's a commercial system, but also that we remain compliant with the World Trade Organization GPA principles. The other fundamental thing to understand is, and I have a separate slide on this, is that there has been a big emphasis on transparency as one of the central key objectives for delivering this new Act as well. Okay, if we move on to the next slide. Okay, so essentially what this slide is saying is that the go live date is the 1st of October 2024. As you can see, we're already on the left-hand side in December 2023, and the knowledge drops have gone out. In fact, you saw on my earlier slide a screen grab from one of their knowledge drops. So everything's on track. There's a fantastic range of support available to you that you could benefit from you. And within my own local authority, I've been ensuring that I've signposted that to all of my colleagues involved in commissioning and in procurement. I would urge you to benefit from that. What you will also see along the bottom is a segment that says platform development, enhanced find a tender service. So your own contracting authorities, head of procurement, will be working with your own eSender, ePortal, the application you use for the electronic sending of your tender documentation, to make sure that everything is all ready for your organisation from the 1st of October. You might want to check with them, but that's what should be happening to enable you to fulfill the obligations with the new notices and the transparency provisions especially. Okay, if we move on to the next slide. Okay, so the key thing is the previous legislation had 7 different effectively procedures that you could use to run a tender. So some of you may remember things like the innovation procedure. What has happened is that the policy team and the legislation has been drafted reflecting on trying to amalgamate several different acts together and trying to produce a more flexible procedure. They've also reflected on actually how many of the previous procedures were actually used. And so what they've done is they've consolidated those 7 procedures into 3 procedures. The key change is the new competitive flexible procedure. Now, this actually is a great enabler for contracting authorities, because what it says is, you know, consider your market, consider your suppliers, consider your objectives, and then it empowers you to design a process that works best to deliver your commissioning outcomes. Now, obviously, today's presentation is around how we can deliver the best sourcing routes to support service users with learning disabilities and autism. So, you know, this is a very empowering set of legislation that enables you to understand your market, also understand the light touch regime provisions, and then construct and design your own process to deliver the best outcomes. It maintains the open procedure, and that's obviously crucial for, especially for the SME agenda. And then it also maintains provisions to direct award. Now, one of the key changes in the direct award area has been a new provision, a new clause, which is around how we can respond. And it's essentially some reflective learning from the experiences of the pandemic, which I'll come on to in a later slide. Okay. We all will have been used to hearing the phrase MEET, most economically advantageous tender. This has been updated in this new legislation and is replaced with MAT, which is most advantageous tender. And again, you know, my understanding and the inference I would take is this is all about the maximising public benefit objective. There's also a duty to remove barriers to SMEs, and then we're going to have a slide where we go through the changes to the light touch regime as well. The great news is that they have kept the light touch regime in the Act moving forward. So some of you may have noticed some things in the green paper. The final outcome has actually been that the light touch regime has been maintained, and actually I think it's probably better and more flexible for commissioners of services for people with learning disabilities and autism than it ever has been. So if we move on to the next slide. Okay, so this section 42 is enables a government minister to make emergency provision for direct awards to save lives. So this is all around the pandemic, and essentially this will flow down to contracting organisations from the minister, and you will receive it in a coordinated central fashion. One of the things, so there's always been a provision to take into consideration prior performance, but what they have done is actually strengthened it in this case. It means that you can take account of poor performance. And what they also have done is they've learned, as I said earlier on, one of the enablers from another country was that they had a really strong central department list. So what we've done as a nation is we've included for that, and the new performance review unit, or the enhanced performance review unit, are now going to actually maintain and consider providers for the central department list, which means when you're going through your selection questionnaire and you're looking at your selection questions, you're going to need to start to consider to check whether any of the providers are on the central department list as well. If you're looking to apply any of those, my own for my own customers and for my own team, I would strongly advise that you could consider doing the same, is check with your legal and procurement team in your contracting authority as well, because there will need to be certain things in place for you to rely on that provision. Okay, as mentioned on the previous transformation slide, we're moving towards a central digital platform. So that means instead of having Contracts Finder and Find a Tender service and having two different platforms, they're moving towards one central one, which will be the Find a Tender service. Notice there are plenty of artifacts online about the central digital platform, if that's of interest to you, and your relevant head of procurement should be able to brief you on that. The key thing here is that essentially the public suppliers, they can all access all the data they need from just reviewing one platform. It'll also be the platform where you publish your notices. Okay, if we move on to the next slide. Right, okay, so this is the slide which I think is really resonant to the audience today, which is the light touch regime. So obviously the light touch regime has a different threshold. It's quite a high threshold in comparison to general service contracts. The great thing is that it has now been, so in the previous legislation, there was some secondary guidance that you could look at. But actually, that's been, in essence, baked into the main legislation now, which means you can take into account the needs of the end user in the award criteria, which they call user choice. Also, you can see in there that they've talked about the ability, and I've got a later slide where you can see about the role of the carer and the carer being able to be involved in the choice of provider as well. There are no mandated minimum timescales for light touch contracts, which is a huge flexibility for commissioners and procurers to take advantage of. Again, previously, their position on standstill periods and the use of voluntary standstill periods was in some secondary guidance. Now, again, it's been baked into the main act as well. There are also provisions for you to make direct awards, and they said that there are increased flexibilities for modifications of the contract during their term. I think we'll learn more about that when those artifacts are released in February and March, but I'd urge you to look at those. I think it's safe to say there will still be limits on just how much you can modify to make sure that there's no material changes to the contract, but we wait to see what comes out in the guidance in there. The CPV codes that are light touch codes, you can find those in the Act. But interestingly, the requirement to publish transparency notices doesn't apply to direct awards from user choice. I've already mentioned that the standstill period doesn't apply to light touch contracts, although the general principle is it's best practice to include for a voluntary standstill period. But if you do include a voluntary standstill, doing a main standstill period is my understanding. So what you will need to do in practice is look at the available timescales in your project and consider whether you want to follow that best practice and never standstill period, or whether given your timescales and the emergency to progress without one, because it's not, as it says there, as a voluntary. Publishing KPIs, which is a big move towards the transparency agenda, applies to all the other procurements in the scope of the legislation, but doesn't apply to light touch contracts. The same as contract performance and poor performance notices, and the same in terms of publishing change notices. These are all provisions that have been put in the main body of the Act to increase transparency. Okay, if we move on to the next page. Okay, so I'm not going to read this out verbatim, but I'm just going to highlight to you that if you look at the 20 and you look at 4B and 4C, essentially what it says is if you're using that competitive flexible procedure, what you can actually do is you can amend, you can refine the award criteria during the course of the tender. And then there's a separate section on section 24, which talks about how you can refine that. Now that to me was quite interesting. I think the key thing will be transparency and making sure that you apply that equally. But I would urge you to take a look at some of the flexibilities that could enable you. Okay, if we move on to the next slide. Okay, interesting again, the bottom section, section 19, talks about awarding contracts from a competitive procedure. And what I point out here is subsection 3D, which says that you may disregard any tender which breaches a procedural requirement set out in a tender notice or associated tender documents. So the key thing there is the word may gives authorities discretion. So again, this would be something for you to discuss with the procurement officers and legal officers supporting you on your tender, but that's something that's quite permissive and in terms of it allows you to use your discretion. Okay, the top section there talks about covered procurement objectives, and you'll see there that one of the overriding principles is equal treatment. Now, it is interesting that in 12.2 and 12.3, subsections 2 and 3, they have provided for treating providers all the same unless there's a difference, which is subsection 2. But subsection 3 says if a contracting authority considers that different treatment is justified in a particular case, the authority must take all reasonable steps to ensure it does not put a supplier at an unfair advantage or disadvantage. So again, there are opportunities there which I would draw your attention to, but again suggest that you seek your own legal and procurement advice before you follow those. Okay, next slide. Okay, so the key thing here is the transparency that I mentioned earlier on. So running throughout this act are a lot more notices that you will need to familiarize yourself with. The idea is that it provides public insight into how their money is being spent, and it allows for effective competition. So it makes sure that suppliers can easily find out opportunities they can compete for. It makes sure that suppliers can monitor changes to any contracts already awarded to themselves or competitors. It makes sure that the general public can actually monitor how contracts are performing when they're above certain values, because there's duty to publish KPIs within the main aspects of the contract. And it can also make sure what's being spent with what particular suppliers. There's a lot of work that's been done with the central digital platform in terms of the information that will be published. And actually, what I would highlight is it enables capabilities within the commissioning teams and the procurement teams to actually do quite a lot of market research and look at that data when it's published, so that you can understand new providers, relative market shares in your areas, lots of different things, opportunities for other contracting authorities to benchmark with. So that'll be interesting to see, and there'll be some tools that will enable you to look at that data as well in that one digital place. Okay, the key thing as well in moving forward is on pipeline. So to enable suppliers to work with commissioners, there's also a duty that any tenders of a lifetime value over £2 million, you will need to publish a pipeline of your future procurements. So if you were going out for a tender for an opportunity for learning disabilities and autism, and the lifetime value is over £2 million, moving forward in that subsection 2 of 93, within 56 days at the start of the financial year, you will need to publish that you're intending to go out to tender. That's a great opportunity to kind of signal to your market, potentially new suppliers as well, to engage with you as commissioners and to work through all the consultations and the various things that you do before you go out to tender. Okay, so if we move forward to the next slide. Okay, dynamic markets are replacing dynamic purchasing systems in the new legislation. Broadly, quite similar in concept, but there are some changes. Essentially, there are a list of providers that you can work with. It's quite a lot to cover. I'm not going to be able to cover it within the scope of this presentation, but I would urge you to familiarize yourself with the different features, advantages, and benefits of the dynamic markets. Okay, if we move on to the next slide. Okay, this slide talks about open frameworks. Now, open frameworks essentially enables us to do some of the stuff that used to be provided for in the pseudo frameworks in previous secondary guidance on the previous set of legislation. Essentially, what it means is that you can open a framework, you can tender an open framework where it has successive scheme of successive frameworks, which essentially means that you have to open the framework up once during the first 3 years and at least once every 5 years, and they can be allowed to operate for a maximum term of 8 years. Every time you open up the framework, that replaces the previous framework. There are provisions in there that you would want to read. The explanatory notes, which these points are quoted from, are very good in explaining it to you. I won't go through them line by line, but it talks about what happens to providers on previous generations of the framework as each successive framework replaces the one that came before it. It's very good tool to be considered by commissioners for LD and autism, because it will enable you to create a list, open that up to people to join, but you will open the framework at set periods rather than it remaining constantly open, which is something which is a feature of a dynamic market. So that for you could have implications on the amount of resource that your team needs to do to support the procurement procedure, which is one of your considerations at the very outset as to whether you would use an open framework or a dynamic market. Okay, if we move on to the next page. Okay, so this essentially has a lot further guidance on it, but the key thing is that second to last bullet point, which is be careful how much you change the terms in each successive generation of the framework, because you need to make sure you don't materially change the framework to such an extent that actually under section 45 you should actually tender a new open framework. So consider the amount of change that you're making in each generation, and again speak to your own legal and procurement teams. Okay, next slide. Okay, so what does this mean theoretically for procurement staff and commissioners supporting autistic people and people with learning disabilities? So what I want to do now is just go through what the light touch regime says, focusing on section 9 and section 23, and then there is a slide which is meant to stimulate discussion. So if we move on to the next slide. Okay, so what you see here in the boxes are actually direct screenshots from the legislation itself. So section 9 simply kind of defines what is a light touch contract and refers to the definition. And then what it talks about is you need to consider the extent to which suppliers from outside the UK, United Kingdom, are likely to want to compete for the contracts. You need to consider and understand to what extent the services are supplied for the benefit of individuals or the community generally. And also, and I find this very useful, is also it talks about you can consider the proximity between the supplier and the recipient of the services. To the point that it's necessary or expedient for the effective and efficient supply of those services. So it's great to see that in the new legislation as well. So section 23 subsection 6 is very useful as well, especially in 23.6a, which says you can take into account the views of the individual who's going to benefit from those services, i.e. the service recipient, or the person providing care to the service recipient. In terms of who should supply the services and how they should be supplied as well. So that's really beneficial, especially in the application to service users with learning disabilities and autism, that their carers' view can be considered as well as their own view as well. And also the fact that you can take into account there on subsection C, the importance of proximity between the supplier and the service recipients as well, which I think personally as well is going to be interesting to see how we can use that for potentially, we'll go on to that in a later slide, about what criteria and what relevance and the relative importance you place on carbon reduction and things like that as well. Okay, and then lastly, 23.6, that last bullet point, this comes from one of the gov.uk documents, but also the additional flexibility recognises the special nature of these contracts and provides a wide discretion to encourage competition wherever possible. So the key thing here is 23 subsection 6 provides additional but non-exhaustive list of what the subject matter of the contract covers for light touch contracts. So that simply means then I think we need to work from the top level of what are the commission objectives, and then work with your procurement team and your legal team to understand the flexibilities that the light touch regime has, both in a stated list and the exhaustive list. Okay, if we move on to the next slide. Okay, so simply put, understanding your possible criteria, meeting the needs of the customer, how those services should be supplied, the proximity of the customer linking to your carbon reduction, the extent of service user and carer user choice, and how you consider price. So for discussion, what's the right order for your contracting authority? What influence does your budget have on this? What sort of process is the most beneficial for you? Understand the features, advantages, and benefits. Apologies for running over, but there was a lot to cover there. I now hand back over to Steve.
Thanks, Greg, for comprehensive coverage there. Next, Julian Blake, who I said at the start is a lawyer who works in this area. So over to you then, please.
I'm a public benefit lawyer, Julian Blake from Stone King. And I look at this from the provider perspective. And really, to be very direct about it, the provider perspective on public service contracts and latterly on public service procurement has been a very frustrated perspective. And so at the beginning of this session, we were talking about myth busting, and I wrote a book about myth busting in relation to the existing public contract regulations, 2015. It was called The Art of the Possible in Public Procurement. And it was quite a modest initial publication. It was written in conjunction with a provider of community transport services, a social enterprise provider, and it resonated. It with a word of mouth success. It passed into LGA guidance pretty quickly. It found its way into the civil society strategy, the government civil society strategy. It's still being referenced in publications now. There was one published by Government Outcomes Lab recently. And the reason it resonated was because it was trying to say, trying to make talk about a corrective, which is that procurement had become process-driven rather than purpose-driven, especially in public services and especially in personalised public services. So a really important point here is the difference between commercial purchasing of goods, for example, and the commissioning of personalised public services. And the rules look like they cover the same rules cover both areas, which is problematic when it comes to everything being focused on the process. The specific, I mean, I had a whole load of cases in relation to procurement where it was really clear that the process was dominating the purpose and distorting the purpose. And that's what The Art of the Possible in Public Procurement said, because I looked at these examples and I thought the law can't possibly be stopping these things happening. Essentially, innovative initiation from public benefit providers, mature social enterprises specifically, being proposed to public authorities being interested, discussions continuing, and then being closed off by somebody saying, procurement won't allow us to talk any further. The specific case that then did actually precipitate that book was travel training. It was a HCT group, community transport group, were suggesting that where you're providing community transport services for vulnerable people who needed the service, they could, in addition, as part of that service, provide training to encourage those individuals or facilitate those individuals to become independent travellers as far as that was possible. That wasn't a service that was being offered by anyone else at the time, although it has become more recognised since then. And to illustrate the point, there were three versions of the procurement story in relation to that offer of a service. One led to the procurement team in the local authority saying this is illegal, we can't proceed, presumably because there was prior engagement of some sort, and that was thought to be offending against the equal treatment principle. Another one went through a formal procurement process. The conversation stopped. It was taken over by the procurement team, and that service then started 2 years later. And the third one, I got involved, said, well, there's nobody else providing this, therefore it could be direct award in the sense that it's a unique service. If you're concerned about not being absolutely certain that it's a unique service, there's a procedure under the existing procurement rules. The voluntary ex-ante transparency notice enables you to market test for other possible providers, put that notice out, nobody responds within 15 days except the provider you know about, you can proceed within 15 days. And that's the process that Norfolk followed. So that was an example of how there is much more flexibility in the existing rules than was understood, and that pretty much all the problems with procurement come from implementation, lack of understanding, focus on process over purpose, rather than the rules themselves. And I would say about the new Procurement Act that really the principles haven't changed at all, really. I would say about the new health regime that it's implementing a lot of the principles that absolutely should have been applicable in public services previously and weren't because of these problems in terms of implementation. Because the commissioning of public services, the commissioning of personalised public services, the commissioning of learning disabled and autistic services, or services for those people, are not really services that are best served by competitive markets, or an attitude that competitive markets is the best way of delivering the necessary service. And the thing about that is really taking us back to what procurement is all about. Procurement is a branch of competition law. So what it is originally doing is protecting, in the European terms, the single market of the European Union from state funds distorting market competition. It's not actually directly focused on best value public services at all. So, but it comes to serve that purpose because it's applying the objectivity principle in relation to the securing of appropriate services. And now that's a really important point, because the procurement rules, when they're applied to public services and personalized services, you need to understand why the idea that the market competition is the best method for securing those services might not be right. And as has just been described, collaboration is a perfectly possible and appropriate approach to personalized services. Now, the existing European-based rules were purposive, permissive, flexible, and facilitating. It was just that atmosphere of them being about market competition and nothing much else was too dominant for the value of that flexibility to be properly recognised. So it was about the idea that the book was about the idea that public service commissioning should be viewed in a more professional way rather than a process-driven way, a less risk-averse way, a more thoughtful way, a more practical way, recognizing that it's all about complexity and difficulty and making reasonable judgments within that setting to achieve the best outcomes for the individuals and the best public value in the delivery of those public services. So things that weren't really focused on in the commissioning of public services as much as they should have been were that it's not just about procurement. You can subsidize, you can grant fund, in other words, you can direct award, you can undertake those market tests to see if there is genuinely a competitive market. You can co-invest, you can joint venture, invest in the services in collaboration. Innovation partnership, that was mentioned earlier. It was very disappointing to me that the innovation partnership is not in the current Act, because that was a very progressive change in 2014-15, which indicated that you can create collaborative relationships within the existing regime. I was talking to Lindsay Maguire, the civil servant who's leading on the Procurement Act, the other day, and asking about the lack of the reference to the innovation partnership in the new rules. And she said, well, it's because it was hardly used. But that was the problem. In fact, that quote at the head of the second section there, that I had many conversations about innovation partnership, and they often were very interested parties talking about the possibility, but very often those conversations ended with, we can't do it because nobody has done it. In other words, it was a risk-averse reason why innovation partnerships didn't happen that much. They allowed co-design, they allowed collaboration. And we did undertake a few of those. There's one in Leicestershire, the Children's Services Innovation Partnership. There's one in Oldham, the Social Prescribing Social Partnership. And they're very much aligned with the idea of alliance contracts, which is another collaborative principle, which was perfectly possible under the existing rules, but little used. So that's the idea that it's about public service can be about creating the collaborative environment where all the participants providing health and social care services in a city, for example, which is the Plymouth example, can collaborate, can be part of an overarching agreement as to how those services can be best coordinated and integrated. So that's an integration process predating the current integrated care systems, but allowing for collaboration under the existing rules. So that was what the Art of the Possible in Public Procurement was all about. It was a plea, really, for those undertaking the commissioning of public services to recognise that procurement should be purposive. Procurement is not the only thing, not the only commissioning method, and to apply a professional approach to ensure that the best value public services are genuinely delivered. Best value in all definitions, not just meaning money, but meaning the optimum combination of economy, efficiency, effectiveness, and equity. So this is really talking about the commissioning of public services, of which procurement is one part. And it's recognising that the commissioning of public services is hugely complex, that it's underfunded, but that if we're talking then about the most important thing, it's the purpose. It's how to put in place the services that are the most beneficial services. And it can feel like this is a lone voice. The art of the possible in public procurement got a lot of recognition, a lot of interest, but it's still quite a minority view when people talk about procurement per se. So I feel it's helpful to indicate that there are others who say the same thing as I'm saying, one of whom is an expert in procurement, Christopher Bovis from Hull University, who speaks in Europe. So I went to Europe to understand what the rules were actually saying. I've heard him speak and shared a platform with him. And one of his points is, why in the United Kingdom was it not using the flexibilities within the existing procurement regime like the flexibilities are used in other parts of Europe? Another interesting one is Malcolm Harbour, CBE, who's an ex-MEP who is actually involved in the drafting of the current procurement regime in Europe. And he recognised the value of what I was saying and said, yes, that's why the innovation partnerships were created and why aren't they being implemented in the UK. He's just been writing a new publication on innovation in procurement to accompany the new Procurement Act, which I've contributed to, and it's sort of the art of the possible Mark II, which is going to be published relatively soon. I think it's also really helpful in practical terms, which is what I'm really talking about, to recognise that there are macroeconomic approaches to public value, which are very helpful when it comes to commissioning public services. The idea of public value being the whole point of a public service is to deliver the value to the population, to make sure that the individual is provided with the right service, that's beneficial to the community, and thereby you're creating the social foundations that allows for a thriving social economy. So, for example, Mariana Mazzucato has that concept of public value at a macroeconomic level. Government should be about the missions. It should be about solving the social care crisis. It should be about solving the climate crisis. And GDP, the financial measures, are an element of that. They're not the purpose of government. Kate Rayworth, Donut Economics, has a similar focus. The idea is we should create the social foundation, the basic needs that everyone needs in society, thereby getting to the outside rim of the donut, where we can then thrive because we've created the foundation for a thriving economy. We mustn't overreach, go the outside perimeter of the donut, for example, by fossil fuels damaging our future and the way we are able to thrive. So again, talking about the mission of government being to create the social foundation, facilitate thriving, and not allow damaging overreach. So there are macroeconomic reformist ideas which are all about being mission driven, which seem to me to be very applicable when it comes to the commissioning of public services. There's a whole range of activity and publication in relation to these areas. I've mentioned a couple there. The Preston model is quite famous for promoting employment through worker cooperatives. The Wigan Deal is quite famous for promoting the idea of collaboration between public authority and community. There's community wealth building and several other elements to that general movement. I think it's interesting that Wales seems to have a more focused approach to this. The mental outlook on procurement is a bit different. It is about the commissioning focus more than the procurement focus. So, for example, in the Care Act in Wales, you've got that list of imperatives, rather like the list of imperatives we just heard about in relation to the new health regime in the UK: voice control, prevention and early intervention, well-being, co-production and multi-agency, things that need to be relevant in the commissioning of public services. There's also a guide in Wales for social care procurement, which is helpful in those terms. So what I'm really talking about is commissioning of public services, commissioning of personalised public services, and the corrective that is not always, or possibly in most circumstances, that's not an environment where the commercialised market is the most appropriate way of thinking about how those services should be delivered. And I'll give you a very important example. There are lots of examples, but domestic abuse services, the domestic abuse umbrella bodies are very exercised by their small charitable community members having to go through formalised, commercialised, market-based tender exercises. And as with many other services, it's just not appropriate. It's the need in domestic abuse is for quality local services, maximising the effect and the coverage, and not competition between the providers of those services. There aren't enough of them, you might say, and that would apply to a whole range of other personalised public services. So that's the general principle. The art of the possible in public procurement would say you can go about the commissioning of those services in a different way, and in a collaborative way, and you shouldn't necessarily be focusing on the market competition process. And in addition, that's what the statutory guidance says under the Domestic Abuse Act. So those commercialised processes are not only wrong in principle, they're actually not complying with the statutory guidance, which literally says you should take proper account that the providers in this sector are likely to be small community charities, and grant funding is more appropriate for them. Now, the light touch regime was mentioned earlier. That's what we're really talking about here. The light touch regime, under the existing rules and the new Procurement Act, is all about maximum flexibility when we're talking about public services, when we're talking about personalised public services. And the light touch regime was not used as much as it should have been under the old regime. It basically, under the existing regime, the old regime, the one that's going to be replaced, basically removes pretty much all the prescriptive requirements of a tender process from the commissioning of social services, for the very good reason that more flexibility is required, and it's not the same thing as purchasing goods and equipment. So the light touch regime has been massively underused. When the Procurement Act bill, when the bill first came out and we were engaged in the consultation, the light touch regime wasn't in the bill. So one of the main focuses of the public benefit sector in the consultation exercise was to say, where's the light touch regime? Where's the special place in the new regime that makes a distinction between purchasing defence equipment and providing personalised social care to people with autism and learning disability? It did come back in, so that was a good part of the consultation process. But we still basically have a Procurement Act that is focused on commercial market competition and doesn't really highlight, as the new health regime does, that there are collaborative models that are really very appropriate and should be focused on as options, at least when we're looking at personalised public services. So I work with an organisation called E3M, which is a group of leading CEOs of mature social enterprises delivering public services. They're turning over between 10 and 200 million. They're successful in their field, successful despite the system, which doesn't particularly support the development of public-driven providers of public services. Also a group of commissioners, also a group of social investors, the idea that they combine their perspectives on how to commission public services in the most effective ways. That was where the art of the possible in public procurement came from. There's a toolkit on the website called the Procurement to Partnership Toolkit. There's a book that's just been published called Vitalising Purpose, and various other models. One of the things we focus on there is talking about the correctives to the commissioning of public services. I've mentioned it a few times, correcting the concept that it's not about market purchasing necessarily. correcting the concept that procurement is only one tool for commissioning public services, and there are a range of other tools that can be employed by public authorities, that everything should be about the public value mission-driven purpose, and that can be consistent with regulatory compliance, which is what the Procurement Act is about, and the budgetary constraints. That the principal concerns are about consultation with those that have the need, their carers, the community, to ensure that the real need is focused on the outcomes, the resources available to focus on those needs, the investment that's needed to support public services, the integration that's required to make them effective, prevention being the ideal approach to engaging with public services, and the consequent savings that follow from that. Another point being that the value of the public benefit sector as providers is underestimated. There's a procurement mantra that the legal status of a provider is immaterial in a competitive environment, but that's not the same thing as precluding the particular distinctive, purpose-aligned, purpose-driven character and often local character of the public benefit sector. So charities and social enterprises are distinctive, and their distinctiveness can properly be recognised within procurement processes by the procurement process requiring the character of the type of service that those organisations typically deliver. And the same is true for local organisations generally and small and medium enterprises generally. And the value they bring, expertise, local engagement. They are interested in the purpose and therefore interested in initiation and innovation and maximising the community resource through their purpose alignment. So we're talking about these things and going back to the correctives, the idea that what we really need is a collaboration theory in procurement of social services, just as has just been described, the collaboration theory that will be newly introduced in relation to health services. Why social services aren't recognised as also benefiting from an emphasis on collaborative approaches, I don't know. But here's the really important point. The light touch regime, with its complete flexibility, allows you to apply all the things that have just been described in relation to the health regime within the social services regime, because we're applying the light touch approach, which only has an objectivity principle, really, and the scheme for how you go about the processes can be, with proper professionalism, applied by reference to what the actual needs are, and not by excessive focus on risk-averse compliance. So really, what I think the commissioning authority can do in this respect is to identify what the real fundamental requirements of a public service provider should be. They should be obviously capable, they should be delivering quality coverage, they should be dedicated, they should be engaged. Ideally, they would be talking in a collaborative way about the costs and those factors, which would lead to open book engagement to mutual benefit. So all of these things are possible. All of these things are possible within the existing regime. All of these things will be possible in the new regime. And the real point here, going back to the myth-busting reference at the beginning, is to say what we really need is to ensure that the emphasis on the flexibilities in the new regime, including the light touch regime, are really taken seriously. Flexibility is taken as the guiding approach, and we don't carry on with the implementation risk aversion, with the process dominating purpose that we have had under the old regime, that was the basis of the art of the possible in public procurement. Start with the purpose, recognise that public value needs to be pursued as the only driving factor, apply the available resources to that, engage collaboratively with the providers of services, including through pre-market engagement, which the new regime does emphasise effectively. Coming on to the Act itself, the things I would highlight in the Act, of course, there are slight procedural changes and rationalisations, but I would highlight above everything else that as does the government, that what's intended is to increase the flexibility. The flexibility is the emphasised, transparency is as well, proportionality is as well, and that was a concern in the past, although proportionality is one of the 4 fundamental procurement principles. So we should never have not really had proportionality. Equal treatment, non-discrimination, transparency and proportionality apply to every single procurement, including the light touch regime procurements, but proportionality was often not the main point of focus in the way that it should have been. There is a recognition, as was said, that small and medium enterprises and the voluntary charity and social enterprise sector have particular needs when it comes to procurement processes or commissioning processes, and they should be taken into account. To some extent they are now. So there's a recognition that procurement should be sensitive to the different scale of operation that those types of organizations typically have, also to the different ways in which they present and offer their services. So that's very positive. I think the very positive reference to public benefit as an imperative in procurement, as well as value for money, that's very welcome. Not just because it's following the social value agenda, but because it's a way in which it is clearly said the public benefit is what is required when you're thinking about procurement or commissioning, and that's absolutely true 100% when we're talking about public services, because it's only about the public value. And I just want to make a distinction there between the social value agenda as it's developed, because it's developed rather as an added value concept. So now it's recognised that all public authorities have their social value policies. All procurements have an allocation to social value, more or less, but it tends to be thought of as an added thing. You're delivering your service, and in addition to that, you're providing some corporate citizenship-like engagement, like if you're a construction company, you're adding some apprenticeship employees to your delivery to help the local employment situation. But when we're talking about public services, when we're talking about learning disabilities and audit, or domestic abuse, or autism, or domestic abuse, or health, or social care, we're talking about the delivery of public value, and social value is not an added thing to that, it's the essence of it. On my second slide, which you can see, there's a summary of what I've been saying, what the correctives to commissioning are in my view. I'll say one last thing, and that is, I'm very concerned about how lawyers go about talking about procurement. Being a lawyer myself, I listened to a session last week, and it was an academic and lawyerly discussion, and all the conversation really was about how there's new uncertainty, we will need to interpret things differently. It'll be interesting how the case law develops, which I think is completely the wrong way of thinking about procurement reform. We should be thinking about the practicalities, the flexibilities, the way in which we can see things more clearly, and the way in which we're now facilitated to focus on flexibility and purpose and collaboration. And the Act does allow us to do that. Actually, the previous regime allowed us to do that as well, but we didn't do it well enough under the old regime, so let's hope we do under the new regime. Thank you.
A massive thank you to our presenters. I think it was really thought-provoking. If you can tell us if there's further webinars on this topic you'd be interested in us organising. I mean, obviously it's quite a lot of change that's coming up, and people are trying to work out quite how is this going to impact, you know, on the people that we are trying to improve services for, and where's the opportunities to make things better. So if there's commissioners interested in talking to us about that, or procurement staff, please do, because we're at the moment sort of shaping what we're interested in doing next year.